This study involves an analysis of the relationship between psychological stress and temporomandibular joint pain. Previous research focused on TMJ pain tended to focus on physical reasons for the condition, but contemporary findings suggest a psychosocial phenomena is central to development of the condition. The NIDCR in 2014 compiled statistics from published literature and determined that confirming the prevalence of TMJ dysfunction and its associated pain was problematic, but concluded the likely value to be somewhere between 5 and 12%. In 1998, Dworkin and Suvanen acknowledged that psychological and psychosocial factors are significant in understanding temporomandibular disorders, just as those factors are significant in understanding other chronic pain disorders. Another study acknowledged the prominence of anxiety as a predisposing factor for the development of temporomandibular disorders. In fact, research conducted in 2009 stated that temporomandibular disorders are often associated with somatic and psychological complaints, including fatigue, sleep disturbances, anxiety, and depression. While multiple studies have noted that temporomandibular disorder tends to be more pronounced with increased age, often appearing during reproductive years, female and among individuals plagued by anxiety and depression, research assessing financial stressors, workplace stressors, and depression-related stressors as they are related to TMJ pain are underrepresented. Study objective. The temporomandibular joint is a typical location to see chronic pain and has been clinically linked to the perceived stress of individuals. This study investigated the relationship between various types of stress and TMJ pain. The methodology of the study included use of responses from the selected questions on the 2015 National Health Interview Survey. Both descriptive and binary logistic regression analyses were performed on 3 stressor categories: job-related stress, financial stress, and depression-type stress, and elicitation of TMJ pain. Table 1 indicates participant characteristics. Participants were on average 49.5 years old. Participant genders were fairly evenly split, with 55.2% female and 44.8% male. The majority of the participants indicated that they were white at 77.7%, black at 14.4%, Asian at 6.1%, and other at 1.8%. Most participants reported education level to be some college at 31%, college grad 29.8%, high school 24.8%, and less than high school 13.9%. Much like gender, the marital status of respondents was nearly split evenly, with married individuals in the majority at 50% compared to unmarried individuals at 49.8%. Those who reported the symptom of TMJ pain were in the minority at 4.4%. Among those who reported TMJ pain, 5.7% were female, 4.7% indicated they were white, 1.5% had some college degree, 5% were unmarried. Concerning the exposure to stressors among those who reported TMJ pain, 17.4% of the people felt hopeless all of the time, 6.2% of the individuals strongly agreed about job interference, and 9.9% were very worried about bills. Table 2 shows the logistic regression results when modeling TMJ pain based on selected demographics and stressors is considered. Specifically, all relationships between the dependent variable and the independent variables yielded statistically significant results. Both unadjusted and adjusted regression models indicated that as age increases, the odds of TMJ pain decreased. Males in this study had lower odds of TMJ pain as compared to their female counterparts. Concerning race and ethnicity in the study, blacks and Asians had lower odds of TMJ pain than their white counterparts. However, those that identified themselves as other-raced had higher odds of TMJ pain compared to whites. Married individuals had lower odds of TMJ pain compared to unmarried individuals, and after adjusting for demographic factors, As stress levels increase, the odds of TMJ pain also increased. Specifically, as feelings of hopelessness increased, odds of TMJ pain increased. Similarly, as feelings of job interference increased, the odds of TMJ pain increased. And as worrying over bills increased, the odds of TMJ pain increased. Overall, the findings of this study indicated that 4.4% of adults in the United States self-reported TMJ pain. Of those with TMJ pain, 6.2% had a job interference stress, 9.9% were very worried about bills, and 17.4% of the respondents reported feeling hopelessness all of the time. As age increases, the odds of experiencing TMJ pain decrease. And after adjusting for demographic factors, as stress levels increase, the odds of TMJ pain also increase. Conclusions and implications for future research. This study establishes the need for a stress evaluation for all patients who present with TMJ pain. Additional studies should be performed to further evaluate this association with clinical studies that investigate TMJ symptoms in patients.